and I'd like to introduce all of them so that we kickstart our program. So the first person on my list, she's a fifth-year medical student studying in Egypt, and she's a cardiology aspirant and a research enthusiast. She's deeply committed to health education, especially first aid, health prevention, and then mental health. Ladies and gentlemen, I introduce to you Miss Aisha Mustafa. If she's in our midst, we'd like to hear her voice. A virtual round of applause for Miss Aisha.
Hello, everyone.
Hi, Aisha.
Thank you all for joining.
All right. So the next on my list is a dedicated nurse and a passionate health advocate. She believes health begins at home and works to make primary health care and first aid knowledge simple, practical, and accessible to families, schools, churches, and communities. Her mission is to educate, inspire, and empower people to take charge of their health. Ladies and gentlemen, I introduce to you Elizabeth Ajwa Janwa. Elizabeth, please, you have to mention the last name yourself.
Yeah, it's
I'm so
Kakari.
sorry.
Yeah.
Okay,
It's better
yes.
Jaja Kakari.
Before the
Thank
webinar, she actually corrected me, but I wanted her to pronounce it herself again so that we
you.
all get yes.
So the name is Kakari, and thank you, Justice, for moderating us, Dr.
You're
Benedicta, and
welcome. You're
the
welcome.
RTC team. Thank you all very much. And we are hoping to make this memorable.
We are hoping to make it a memorable one too as well. Thank you, Elizabeth. And the last person on our list is a medical student at the Kwame Nkrumah University of Science and Technology, School of Medicine, sorry. A passionate public health. He's passionate, sorry, about
Hello. Hello. Oh, can you hear me?
All right. So sorry for that. So, ladies and gentlemen, I introduce to you Franklin Boyson. Please, if he's on the call, let's hear from him.
Please, good evening.
Good evening. Hi,
Yes.
Franklin.
I can say.
All right. All right.
Okay.
The virtual round of applause for our speakers. Okay. So, please give me a couple of minutes. Let me share my slide. Hello. Okay, so before our first speaker take us through what she has for us today, I'd like to ask this question. Do helpers at accident scene truly help or harm? Let's think about this as Elizabeth takes over to take us through what she has prepared for us today. Elizabeth, your audience, your first speaker, Elizabeth. Elizabeth, can you hear me?
Yes, I can hear you.
All right,
And thank
the floor
you,
is yours.
Honorable Justice, for letting me in. Good evening, everyone. Today
Good
we
evening.
want to ask a bold question. Do helpers at accident scenes truly help? Sometimes we clap for them, but other times their actions make things worse. Let's explore into this together. Taking a look at the picture in view, what comes to mind? This is a vivid description of what most accident scenes look like. This question will be passed to receive your thoughts after the session as we delve into our main context for today. So please can we move on to the next slide. So this is a question we ask everyone. Have you ever witnessed or been part of helping at an accident scene? What did you see and what did you do? So this is a question to everyone. And as I said earlier, it's a rhetorical question and we'll pick the feedback after the session. So what is an accident? Accident is an unfortunate incident that happens unexpectedly and unintentionally, typically resulting in damage or injury. They happen every day in our homes, schools, churches, workplace, and on roads. So this is telling us that accidents are not planned. Accidents can happen at any time, anywhere. It doesn't give you any pre-announcement, and it just counts as it is. Please let's move on to the next slide where we'll be talking about road traffic accidents itself. So road traffic accidents are sudden, chaotic, and emotional. So you may have seen it on the motorway, in the news, social media, or near your own house. A crowd gathers, everyone shouting, some rushing to touch the victim. But pause, are they saving lives or are they risking them? This is what we are looking at today. Please can move on to the next slide, where we are talking about helpers. So when accidents happen, there are most people that we see on the scene, and these people are mostly termed as helpers. So helpers are everyday people, sometimes trained or often not. A helper can be a passerby, sometimes a nurse who happens to be around, sometimes a police, a fire officer, or in our country here in Ghana, it could even be the church mate, the church driver, the market woman, or a motor rider. And this reminds me of a moment at the emergency ward where a tricycle, where we popularly know as Aboboya, was the one which transported two accident victims to the hospital. And this person could be termed as a helper. There are two sides of help. The one who can cause more harm than good, and those who know just what they are doing. This makes us look at what are the good sides of helpers and what the bad sides of helpers are. So a good helper is one that comes to the scene knowing what they are about. They are lifesavers. These people on the scene immediately call for help, which is actually the first thing to do when you get to an accident scene. So they call for help. So that's why it's very necessary for us to know our emergency number. They can call the ambulance or the police or even the nearest hospital. And those trained in the first aid who can make big difference. First aiders also sometimes give comfort and reassurance as the good sides of helpers to accident victims. And remember, the first few minutes can determine life or death to the victims. So moving on to the risks or harms of helpers. Before I delve into it, I would want us to take a look at the scene on the screen. This is a car which has crashed. Bystanders crowded around the car. With the most trending event of our time, the content creators, as everyone will call them. Everyone is with their phones trying to be the first reported and the first to post it on social media instead of helping. Those who try to help may also drag victims who need to be stationed whilst waiting for aid. Let's take note. It's not everyone who has to be moved from the car at the scene of accident instantly, because it might damage their spine or cause further injuries or even cause more bleeding. Crowding at the scene may also delay professionals from getting in. How cars are packed can also prevent ambulance from trooping in to reach the site. At that moment, what should the victims also do? They need a safe environment. A helper can be good at this scene by helping to direct traffic to ease the first aiders to come into that place. Please, a call to everyone. If you know you can't stay calm, avoid the scene area. At that moment, the victims need reassurance. They need comfort and a spark of encouragement to hold and not panicking. If you get to the site and you're panicking and you're just throwing yourself all around, please, this is not a call for everyone. If you think you cannot stand the scene, just stand afar and watch from that view. If you know you cannot help, don't go closer. At that moment, the victims are in pain. At that moment, some of them are crashing. Some of them are holding on to their last breath. Some of them are in pain. Some of them has lost a limb or some part of their body that they don't know what their next step should be or their next fate will be. They're in between life or death. And the only thing they don't want is for you to come and just make matters worse. At that moment, they need reassurance. At that moment, they need comfort. At that moment, they need someone to hold tightly to them. So sometimes I call these people 419 for first aided. Please, we know some people might want to help, or some of you have knowledge on what to do, but don't do what is beyond your limit to harm instead of help. If you reach an accident scene and there are victims there and you want to help them, do what you can do and don't go above your limit. If yours is to help them, position them at a safe area, do that and call for help. Don't do something that will either jeopardize the life of the person forever, or instead of helping, you end the person with a disability for life or even make them lose their life at that moment. So we've seen the good and the bad side of road accident or accident. But what should we actually do when faced with such situations? My colleague Aisha will take us through and will know what we should actually do when we get to the scenes of accidents. Thank you.
A virtual round of applause for Elizabeth as Aisha takes the floor.
Hello, ladies and gentlemen.
Hi, Aisha.
Thank you all for joining, and I'm really happy to be here. Thank you, RTC Foundation and Dr. Benedicta, for this great opportunity. And thank you, our wonderful moderator, for the warm introduction. So, when there is an accident, there are two sides of the coin. With regards to the rescuers, we have those who actually help and those who do more harm than good, but then thinking that they are helping the victims. So which side do you want to be as a rescuer? That is why we are here. So it is my hope that by the end of this session, everyone will be on the good side. So I'll tackle the first aid. Before I start, I want us to do this exercise, right? So I'm not going to give the answers, and then no one is going to discuss the answers now. By the end of my presentation, we'll come back to this same page and then have the answers. So imagine, even though we don't pray for accidents to happen, but then accidents happen every day. Every single day there are accidents. So imagine there is an accident, there is a car crash, and then there are casualties, right? As usual, the community gathers. There's a group of people, there's a crowd, and then chaos. Everyone is saying something. Everyone has something to say. Then here comes Bra Kofi. Bra Kofi suggested that, no, we have to drag the victims out immediately. The faster we do that, the better. Here comes Auntie Araba, the good woman in the community, always serving people food and water. So she suggested that, okay, she says, give the victims water or food to make them strong. Atamami comes in. Hey, there is an unconscious man lying there. Bring me the gallon of water. I need to splash water on his face. Then here comes John, the student in their midst. John says, CPR saves life, but I don't know how to do it. I'll do it regardless because I need to help. Then Amelia comes in. Hey, he's convulsing. Bring me the spoon. Let me put it in his mouth before he chews on his tongue or swallow it. So here is a scenario. You as a medical practitioner, you as a non-medic, everyone is involved here. What do you think? Who is right among these people and who is wrong and why? We will come back to this slide. Let's move on to what first aid is. So, first aid. First aid is defined as the immediate care given to someone who is injured or suddenly ill before professionals arrive. Because whenever there is an emergency or someone falls ill, you cannot expect the professionals to be there in the next minute. So what happens before the arrival of the professionals? You need to do something. What's the aim of first aid at all? We do first aid to preserve life, to prevent the condition from deteriorating, to promote recovery. Because as Miss Elizabeth mentioned, the first few minutes after an accident matters a lot. The first few minutes, if you don't do something, before the professionals arrive, you might have lost your patient, or the victims would they paralyze, or they get severe complications. But then doing something as simple as dialing the emergency number, or something as simple as just stopping the bleeding by, okay, we'll talk about it later, can really, really help. It will really go a long way. So next on our slide, we have how to navigate first aid. First of all, as a rescuer, you have to stay calm. You have to be as calm as possible. And you have to check for your safety. If you as a rescuer is not safe, how much more the victim? So you have to call the emergency number. Depending on the country you're coming from, you have to assess the injury. Check for consciousness. How do you check for consciousness? So tell the patient, can you hear me? Hello, can you hear me? So if the patient is alive or the patient is conscious, the patient will respond to you. Check for the breathing of the patient. Is the patient able? You can just do you can do that by putting your finger just underneath the nostrils of the patient to sense or to feel the vapor. Or you can just look at the chest of the patient to see if it's rising or not. You check the pulse. Well, checking the pulse is really hard for some non-medics, but then don't worry if you cannot find the pulse. Just focus on the consciousness and then the breathing. If your patient is not conscious and is not breathing, you have to take the next step, which we'll talk about later. And you have to prioritize severe injuries. So comparing someone who is bleeding profusely to someone who just has a scratch, you cannot leave the one bleeding in order to attend to the one with just a mere scratch. So you have to prioritize the injuries. Apply first aid, which we'll talk about later. Don't move unnecessarily. This is a very, very important point because in our community, whenever there is an accident, people are rushing to move the victims to the nearby taxi and then to the hospitals, which is very wrong. You have to stabilize the patient. Do not move the patient unless, and I repeat, do not move the patient unless there's a risk coming. There's a risk ahead. Maybe there is fire or there's the risk of explosion. That is the only time you need to move these patients. Other than that, leave them where they are. Reassure the patients. You have to comfort them, tell them they will be fine. The ambulance is on the way. You have to keep them as calm as possible. Providing first aid. So first, if there is bleeding, you need to control the bleeding by applying direct pressure to any wound with clean cloth or bandage. Keep them still. See, this point is very important, so I'm going to repeat it. Do not move injured individuals unless there is an immediate threat like fire. Moving victims without stabilizing their neck or back can cause spinal injury or paralysis. Clean the airway. How do you clean the airway? So if the patient is lying on their back, and then there's risk of airway, you can sense that the patient is finding it difficult to breathe. You can do so. You can clear the airway by simply tilting their head backwards and then lifting their chin. By so doing, the tongue is a very big muscle. So if someone is lying on their back, it can easily block the airway. So the person will find it difficult to breathe. So when you tilt their head backwards and then raise their chin, you bring the tongue forward, enabling the patient or the person to be able to breathe well. Speak calmly to the victim and provide reassurance to help keep them calm and prevent shock. So here you are preventing psychological shock because that one is also very important. If they are not calm, there's a risk of psychological shock. Use clothing or bandage to support any injured limbs to prevent further harm. So if there is a fracture somewhere, you have to prevent the fracture from deteriorating. You have to prevent the fracture from piercing maybe a blood vessel or a nerve. So you have to use clothing or bandage to support that particular limb. Monitor the victim as you wait for the arrival of the professionals. So sometimes someone might say, I've already checked this victim, so let me move to the next person and then forget about coming back to that same victim. For all you know, the victim's condition may deteriorate at any point. So as you move on to next victims, you have to come back and monitor these victims. If there is any stability or there is any deterioration, you know what to do next. So we have cardiopulmonary resuscitation, CPR. Because we don't have much time, we are just going to talk about it briefly. And then I entreat each and every one of us to have first aid training. It is very, very, very crucial in our everyday life. So when there is, if a patient is not responding to you, as we mentioned earlier on, you check for the consciousness of the person and then the breathing. So if the person is not breathing, and if you're able to check the pulse and then you realize there is no pulse, you need to do CPR as soon as possible. How do you do CPR? So first, CPR is very important because it's not just about doing CPR. You have to do it right. Where are you doing it? Where are you placing your hand? So you have to place your hand in the middle of the chest. So for you to know the exact place to place your hand, you just have to draw an imaginary line between the two nipples. Please, I didn't say you should go and hold things. Just an imaginary line between the two nipples. Midway between that line, you locate the area where you should do the CPR. So first, you have to put the heel of one hand in the center, preferably your dominant hand. So if you're right-handed, you place the heel of your right hand in the center of the chest, and then the other one on top. Then you push hard and then fast. So you don't want to waste time. What you are doing is that you are making the heart pump blood. So you have to do it. You have to push deeper, like 5 centimeters deep, and then it has to be fast. But I'm not saying you should do it rapidly. So you should aim about 100 to 120 compressions in 1 minute. So you do 30 compressions per cycle. You do 30 compressions per cycle. So after the 30 compressions, then you give 2 rescue breaths. That is mouth-to-mouth breathing. But that one, it's a bit controversial because usually these people are not people you know. You don't even know if they have infections or not. And sometimes most of them might have vomited or they have bleeding, they are vomiting blood. You cannot risk that. And some people are just merely disgusted by the thought of putting their mouth on another person's mouth. So if you have that problem, you can decide not to do the mouth-to-mouth breathing and then just focus on the chest compression, but make sure you don't exceed 120 compressions per minute. So you do so, and then you don't stop the chest compression until the patient regains consciousness or the medicals arrive or you yourself, you are fatigued, like you are exhausted, you cannot do it again. That one, it is nature, you can't do it. That one you can stop. But maybe there will be other rescuers to help you. Then we move to the next one, which is choking. So sometimes these people, right, when accidents happen, some people vomit, and then some people might be bleeding and then be vomiting blood. So this can lead to choking. Choking simply is choking, also known as foreign body airway obstruction, is a phenomenon that occurs when breathing is impeded by a blockage inside the respiratory tract. So inside your airway, the system that is helping you breathe. So when blood enters inside, or vomitous, or any liquid or solid, it's not limited to just liquid. Usually in our everyday life, it could be, maybe someone could be eating a nut and then mistakenly it will enter the airway. So the reflex that happens when something enters inside the airway is coughing. That is the natural reflex that happens. So the person begins to cough. What should you do when you find someone choking? First and foremost, if the person is able to cough, that is the natural reflex. Allow them to cough. It's so simple. Don't do anything. Don't interrupt their coughing. Don't give them water. Allow them to cough. Let them cough the foreign body out. So simply allow them to cough. So when they are coughing, you just monitor them. Don't interrupt them. Giving them, people like to give victims or people coughing water. It is very dangerous because the water might also enter the airway and induce more coughing and even lead to a very serious complication. Don't give them water. You only give them water when they expel the foreign body out. When that foreign body is out and then the cough is about subsiding, then you give them water. Other than that, do not give them water. So what happens if your patient, you meet the victim and then the victim has coughed and is now very weak and cannot cough? What do you do? If the patient or the victim is still able to stand, support them in front of you, like the picture you are seeing. Support them with one hand and then use your dominant hand to give a back blow. Where do you give this back blow? Between the two scapula. What's this? Between the two, what's it called? Your scapula. What's the name for scapula? The usual name for scapula. The bones at your back, your right and left side. So in the midline up, you give the blow there. So you give a back blow, 5 of them. Hopefully the foreign body will be expelled. But then if the foreign body does not come out, I'm talking about general way of helping a choking person. In the case of road traffic accidents, usually you allow them to cough, and then, but because it's liquid, if it is blood or if it is vomitous, they will be okay. So, but generally, let's say a nut or something else enters inside the airway, and then the coughing is not coming, then you give the back blow. If the back blow is not helping, we have the third one, which is abdominal thrust. So that is the maneuver you can see on your right. You make a fist with your dominant hand in the abdomen, just above the navel, Then you use the other hand to support it. Then you give an inward and upward thrust, as if you want to raise the patient up. So when you do that, hopefully the foreign body will be expelled. Yeah. So the time is limited. We cannot go on and on about first aid because there are a lot of first aid to do. So I entreat you once again to get a training in first aid. So this brings us back to our exercise. I hope that by now you know what to do and what not to do during or when there is an accident. So I want someone to please unmute their mic and then tell us if who was right among these people, whether Bra Kofi was right, Auntie Araba was right, Atamame, John or Amelia, and why. Who can do that for us, please?
Oh, if you're not getting anyone, I can get someone for you.
Yeah, hello. Hello.
Hi.
Yeah, good afternoon.
Good afternoon, sir.
I'm Mohammed Awad Tahiru. So with this exercise, I think number one, Brad Kofi said, let's drag the victims out immediately. The faster the better. So at this point, I think that wouldn't be appropriate since when there is an accident, we need to check the surrounding and then see whether the surrounding is safe first before any action can be taken. And then number two, Antiaraba says give the victims water or food to make them strong, which with these two at that instant, it wouldn't be appropriate to do that. To give the victim food and then water at that instant. And then number three with Atamami says there's an unconscious man lying there. Bring the gallon of water. I need to splash water on him. And with these two, it would be dangerous to sprinkle water or splash water on the casualty. And the best thing to do is to give him or her air. And then number four with John, that CPR saves life, but I don't know how to do it. I will do it regardless because I need to help. So with the CPR, I've forgotten the full meaning for the CPR. I think the R stands for responsiveness, and then I've forgotten the full meaning. But then it is that's one of the best. Uh, so yes, cardiopulmonary resuscitation. Resuscitation. Yes, so the CPR will be very appropriate at that instance. Meanwhile, it is necessary to know how to do it. And then in this case, he's saying that he doesn't know how to do the CPR. Meanwhile, he's going to try it anyway, which one way or the other, it can cause harm when we don't have the knowledge or the knowledge. John doesn't have the knowledge to go about it. And then finally, Amaria also says, hey, how is convulsion? He's okay. He said he's convulsional. Bring me the spoon. Let me put it in his mouth before he chews on his tongue. Okay, so with this, I can't give an answer. I don't have an idea. Thank you very much.
Thank you so much, Brother Awol. Thank you so much for this contribution. You really did well. So let me go over everything. You really did well. So with
Thank you.
BRCA, as I already mentioned, do not
Yeah.
move the patient until there is a risk, like there is a threat. So
Yeah.
do not move the patient because you might damage the spinal cord, leading to paralysis or causing further bleeding, which we don't want. So in regards to anti-Araba, give the victims water or food to make them strong. They don't need water or food at that moment because they might even be having internal bleeding. They might be needing surgery for all you know. And then when you give them this food and water, you might end up causing more damage. Then at Tamame, there's an unconscious man lying there. Bring me the gallon of water. I need to splash water on him. So here is the case. This brings us to the choking. If you splash water on him, it might enter the mouth and then enter inside the airway. The patient might end up choking. You wouldn't want that. So instead, when the patient is lying down, you have to put them in a recovery position, especially if they are vomiting or if there is bleeding. Place them in a recovery position. That is, place them on their side. That way, the saliva or the vomitors or the blood will just come out through the side and it will not enter the airway and induce choking. So John said CPR saves lives, but I don't know how to do it. I will do it regardless because I need to help. In as much as you need to help right. So John is wrong here because if you don't know the right way of doing CPR, it is as if you are not doing anything, or you might even be doing more danger because if you don't locate the right place to do the CPR, these people are accident victims. They are very fragile. Then you go and then push into their ribs or apply a mechanical pressure, like a pressure to the ribs. You might fracture the ribs, and you don't want to do that. That is a very serious condition. So if you don't know how to do CPR, don't do CPR. What help can you do? Call emergency number. What other help can you do? You can reassure them. You can help calm them. Don't do what you can do. As Miss Elizabeth mentioned, do not go beyond your limits. If all you can do is to provide calmness and then reassurance to the victims, do that. Full stop. Don't go and do oversabi. Don't do something you can't do. Then, finally, Amelia said, hey, he's convulsing. Bring me the spoon. Let me put it in his mouth before he chews on his tongue. So there's this myth in the community that when someone is convulsing, people tend to use the word epilepsy. But epilepsy, not every convulsing person is epileptic. But what epilepsy patients do is what is known as convulsion, right? So sometimes when there's an accident or someone is severely sick, they can convulse. So when someone is convulsing like that, there's a myth that they might swallow their tongue. Just imagine that as they are convulsing, they might swallow the tongue or they might chew on the tongue. Yes, if they are convulsing, usually these people, they tend to bite on the lateral side of their tongue, the tongue that is closer to their teeth, the molar and then the premolar teeth. They tend to bite on them. But this biting, yes, there will be pain. Yes, they might bleed. But then it's not as dangerous as placing a spoon in their mouth. Placing a spoon in their mouth can, one, break their teeth or even cause more damage by what? Blocking the airway. You need them to breathe. And then you are placing a spoon in their mouth. How would they breathe? So if you are to, sometimes you don't have any other choice because both you are faced with two situations which are both risky, which are both dangerous, but then you have to choose the one which is less dangerous, which is if the patient, not all convulsive victims of patients end up biting their tongues. Some do not bite their tongues. And even if they do, biting their tongue is just like having an injury. It will heal. What about putting a spoon in their mouth to bring out their incisors? When will you fix that incisors that you bring out? So you have to wait. So putting a spoon in the mouth of a convulsing patient or victim is not good. what do you do instead? Because they are convulsing, they could be drooling, they could be having saliva coming out of their mouth. So you put them in the recovery position again. That is the position on their side, so that whether they are salivating too much or they are vomiting or whatever it is just going to come out of the side, and there wouldn't be any risk of aspiration. There wouldn't be any risk of convulsion. So thank you so much for the interaction, and I will end here. My colleague, Master Franklin, will take over from here. Thank you so much.
Oh, thank you, Aisha. Oh, a virtual round of applause for Aisha. The first aiders in our midst are doing the most over here, giving us well-detailed education when it comes to us. Don't go and touch things, as she said. And from the exercise, I can see that John is part of the people that have that mentality to go and touch things. As familiars, I don't want to talk. All right, let's welcome Boysen to take over. Then we'll wrap up and take questions and have some few dialogues about the entire topic. Boysen, over to you.
Yes, please, good evening. Please, good evening.
Good evening.
Okay, so thank you all for being here. And I believe this one topic that affects us all, directly or indirectly, to help us at accident scenes really helping or rather giving harm. I believe this is a question that gets to the very human instinct, the desire to help someone in trouble. But as we all see, good intentions aren't always enough. Knowing how to help makes the difference. So now let's get into it. Please, can I get a slide? Okay. So you just imagine driving or walking home and you witness a road accident. It could be a loved one who suddenly collapsed in front of you. What do you do then? So globally, the World Health Organization has a powerful statement that states that the first 10 minutes after an accident are golden. They are the minutes that can decide survival. This is because within these minutes, the actions and inactions of a person determine whether the person is going to survive or die. So what you do within this time frame really, really matters. And I believe that's what my speakers have been hitting on. Your actions and what you're going to say, what you're going to do really matters in this small window frame. Very, very, very important. And during an accident, in these few 10 minutes, who is likely to be there? It is you, it is I, the bystanders. So we are the regular people that are always around during accident scenes. Before the medical personnel even comes in, we are the first contact. That's why we need to get this knowledge and these skills in first aid and other stuff. Let's just narrow it down to Ghana. Let's bring it home. Ghana. Our ambulance service is really, really improving, and that's very good. But as we know, its work is still in progress. Response times can be long, and that's not a criticism of the service. I need to state fact, but it is a reality we are facing. You can get to them, but for them to get there in the shortest possible time is very, very rare. They take more than 20 minutes, 30 minutes, and that's when you come in. The road network, very bad. And even the net, we are really, really important when it comes to these things. The bystanders, we are the first respondents on the scene. When you go to the various countries like Canada, Australia, and those Europe, Western countries, they have these good Samaritan laws that protect people, that provide reasonable services to victims. The purpose is just to reduce hesitation to help for fear of being sued, because in those kind of countries, when you help somebody on an accident scene and after the person is healed and the victim gets to find out that, oh, because the person helped me and now I'm in this position, he or she can sue you for you coming in to help. Although ideologically it's a good idea to help, but the victim can be like, you helped me in a bad way, so I can sue you. So they actually brought in these laws to reduce the resistance we normally bystanders get into, because not recently, I think in 2018 or 2017, China, one young girl accidentally died. Not died at that instant, but was knocked down. Bystanders were just there. And from feedback, people gave various information that they felt that they wanted to help, but in their head or in their instinctively, they were like, what if I help and the person dies? What if I do this and the person falls into other situation? Wouldn't I be sued? Wouldn't I be held responsible? So the law was actually passed to help reduce this kind of resistance that normally comes or playing a role. Please, the next slide. So then what at all can we do in Ghana? What are the practical steps we can take to move from potentially harming to definitely helping? It starts with empowerment through knowledge and training. We can first of all bring first aid training to schools and workplaces. You just imagine a future where every student leaves school with basic first aid skills, just like they learn the math and
Hello, what are you
science.
saying?
Hi. Hello. Please, can you hear me? Hello.
Yes, we can. We can hear you. Please continue.
Okay, please. Okay, so just as I was saying, let's have a future where every student leaves schools with basic first aid skills, not just as they learn the math and science they do. Because I can't bet that when you go to various schools, they do have the Red Cross Society, they have this kind of various science clubs and stuff, but they can not debunking the fact that the society is not good or not, but they have the society in quotes just for decorations. But if they have this society in various schools and they involve themselves in various training and various workshops, I believe will go a long way to help most of them. Because you leave in school with the basic life skills hacks, you get to the house, somebody has a car, somebody has a bang, somebody has collapsed, somebody is choking. You right to know what to do. You don't need to just wait for that long time for a paramedic or health person to come and attend to the person. Your first response helps to save a life. But it's not just about the formal education. We can also use our communities like the churches and the mosques to run simple, accessible first aid workshops. Because this is a community where people gather and trust is very paramount. And people will really feel comfortable and encouraged to learn these vital skills. Moving on. I believe this also means we can also strengthen our emergency system and public awarenesses. It's not enough to know what to do. You also need to know what not to do. For example, like what Miss Elizabeth rightly said, or it was Miss Aisha, one of them, yes, moving an accident victim who may have a spinal injury is more often harmful than helpful. People might think, oh, let me just move the person from the vehicle. I might be helping, but in reality, you're actually harming the individual. So having this knowledge and organize these workshops and these various first aid skills will actually bring into knowledge what not to do and what to do during accident scenes. And
Hey,
this,
network,
hello,
don't mess with me.
please, I hope I can be heard.
Yes, please, you can.
Oh, okay. Okay, thank you very much. And also these various workshops and this first aid training can also be channeled to our various villages and stuff. Because uh, we should state the fact, Ghana, although we are improving our spirituality and our God work Christianity, we're also based on superstitions and stuff. Something can happen and people will be relating or people will be trying to go with the normal traditional ways, which are harmful. So organizing various workshops in these villages, these communities, in quote, can bring into light various things they are doing which are very, very bad. With the church also, a church can go for various convention programs. Yes. If you have somebody who is trained in first aid, who has knowledge in treating accidents, various accidents that might occur. It will save time, save health, and also save a life. All these are very, very, very crucial points. We must move from harmful helping to responsible helping. Harmful helping is driven by panic and lack of knowledge, which various speakers, I believe, have already dealt much on it. Because if you don't have the knowledge, we tend to provide harmful help rather than helpful help. I don't know whether that's a word or two. Yes. So with all that I've said, where at all can you get this first aid training and everything? So the first one is St. John Ambulance Ghana. They are a very well known and respected institution with a long history of providing first aid services and training. We have the Ghana Red Cross Society, which is a globally recognized leader in disaster relief and first aid training. Their program are top notch and will equip with a wide range skills. And we have the commercial training like the International SOS, PACL, or the high capacity resources. Now, if you want to have a specific training offering, you can use the online directory at the Global First Aid Center.org directory to locate specific training offerings. So to end and to conclude and finally say, being a helper at an accident scene is a truly noble act. But our goal should be to ensure that every act of helping is an act of responsible, effective assistance. By seeking training, empowering our community, and knowing our limits, just as Aisha said, don't get and touch this, and know your limits, don't overdo. We can ensure that we are truly helping and not harming. Thank you. So now we take
Thank you
questions.
so much. Thank you so much, Franklin. Thank you so much,
You're welcome.
Elizabeth. And thank you so much, Aisha. So we now welcome questions. This is the point where we will have dialogue questions. Please, if you don't ask question, me, I'll call you.
Okay, I have a question.
Okay. If
Can
you
I
don't
ask?
ask question, I will call you. I can promise you that. Franklin, ask your question.
Okay. So I've heard from, not I've, I read various books and from various health professionals that, you see, in our normal community settings, when somebody has a cat, I'm trying to drive away from the various road accidents we've been seeing into our normal homes. Yes, we use the mutilated spirit to treat the wounds. And from researches and from what I've read and what I've heard, this is not a very good act, because you using the mutilated spirit to treat a wound is really bad, because it tends to kill the cells and prevents the clotting factors from actually working. Because the methylated spirits are actually designed to work on bacteria to clean the skin, not to treat wounds. So my
Yes.
question is,
Anybody to help? Yes, I've also heard that. I've also read those articles concerning the fact that we shouldn't use methylated spirits to treat wounds. It's rather tend to yes. Hello. Hello.
hello,
Hello.
hello.
Hello. Yeah, you can be there.
Please go ahead. We can hear you.
And so basically my question is about these things. What do I do then? Should I just let the bleeding continue? Because we all know that that's what we normally do. We use the methylated spirit. People are like, oh, when you use it to stop the bleeding, everything will be fine. So yeah, so what do I do then? What do we do, basically? Thank you.
All
Okay.
right, boyfriend. Aisha, you can take on.
No,
Maya.
go over. Go on.
All right, so boyfriend, thanks for throwing out this general question to us. Yes, that's true. In a way, because the methylated spirit has its own properties in it. It has its harsh properties due to its chemical compounds.
Hello.
Hello. Due to its chemical compounds, which can be harsh on a fresh wound. Because in the process of someone injuring themselves and having a wound, to know that at that moment, it's not the cells at the site of the wound, it's not all of them that are dead cells. At that moment, there might be some living cells, the which applying this methylated spirit can harm them or also cause more harm. So the best way to do in a scene where there is a wound, mostly an open wound, is to run it with water. That's clean water to be precise. So a running water. So you can get a water and wash the site of the wound. That's preferably what should be done. So you should wash the sides of the wound. Washing the sides of the wound might show the depth of the wound, the size of the wound, if there are anything stuck in the wound or so on, to know the next step to take. So methylated spray can be another option. Maybe it can be used not directly into the wound, but to clean the size of the wound. Because here the motive behind it is to prevent infection. So you can use to clean the sides of the wound, but not into the wound. Or in view of that, instead of using the spirit, you can use provident iodine, what most sometimes we call dread, or sometimes some diluted Savlon. You can use that to clean the sides of the wound, but not directly putting them into the wound. I think that.
Okay, please, thank you.
Yes. Thank you so much, Elizabeth, for that answer. So, question time. Please, I'm very eligible to call anyone for question. Abigail, your name is Sampon.
Please, there's a question here
Okay.
in the comment section. Yes. The person is asking in administering CPR, what do you do to
Yes.
make sure the clothes are loose and not worsen the case of the person?
Miss Aisha,
Why?
are you up for this?
Okay. Thank you very much for the question. So, in a situation where the victim has a tight cloth on, right, and then there are no visible injuries, like maybe the victim does not have stark injuries, like you don't see any form of injuries, you can, if the person is wearing a shirt, you can just unfasten the buttons and then do it. And it just has to be the upper part. You don't have to go and unzip or remove their trousers or something. It just has to be the upper part. And if they are wearing a loose cloth, you don't have to remove anything. You don't have to remove. It's only when the upper part, maybe they are wearing a collar, or something, then that one you can just loosen it a bit. Because in that situation, you don't even know if they have fractures at their back or they have neck injuries or spinal injuries. So do not really focus on removing their cloth or loosening it unless you are very certain that there are no injuries. And secondly, that the cloths are too tight. If they are too tight, you need to loosen them. I hope I answered your question. Thank you.
All right. Question. Question. May I call someone?
Okay, I
Elias.
have a question.
Okay.
Please, with the choking, what if it's a baby? How do you go about it? Do you have to hit the baby's back, or I don't know? I want to be sure. Thank you.
Thank you
you
so
for
much
the
for that
question.
question. Aisha.
Yeah. So with the babies are very fragile. You can't do even if you have to do the back, it depends on the age. So if it's an infant, right? If it's an infant, sometimes you remember the abdominal thrust I mentioned. You can use your two fingers, like your index and then your middle finger, to as if you are doing CPR for the baby, and then with the expectation that it will expel the foreign body out. Or you can inspect the mouth after as you are doing that, you inspect the mouth to see if there is any foreign body in the mouth or in the airway, so that you just use a finger to just sweep out the foreign body. With babies, they are delicate. You need to be delicate. You need to be very careful about the maneuvers as you do. You try to rescue them. I don't know if you got me. Thank you.
Yeah. Yes, please. Thank you.
You're welcome.
Any more questions? I have an audience here that wants to ask a question.
Hello,
Speakers.
everyone.
So, hello.
Hello,
Is that
everyone.
Bello?
Hello.
Yes, please.
All right, Bello.
Thank you very much for your lectures and presentation. My question is, I want to know the absolute contraindication for CPR on behalf of the accident patient.
Absolute contraindications for CPR. So if the patient is confirmed, like if you didn't witness, okay, in the case of accident, generally absolute contraindication for CPR is if you did not witness the arrest, like you did not witness the arrest. Even with that one, you still have to do the CPR for some time. And then if the patient is not responding, say like 30 minutes, then you just stop and then go ahead with maybe the other ones. And then also if there are rib fractures, you don't want to worsen the case, right?
Mostly Monday suke dokan kaya wurin.
You don't want to worsen the case. So absolute contraindications is not to initiate CPR. Or maybe the patient is dead. You know that this patient is dead. So you're not supposed to focus on that patient. Or there are legal documentation that this person is saying. You know, these Western countries, there are people who say do not resuscitate. Maybe it's tattooed on their body. Do not do it. Or maybe there's a stiffening of the patient's body. We call it rigor mortis. It's too stiff. Or like irreversible death. The patient is dead. So whatever you do, you cannot resuscitate the person. Or maybe there are too much rib fractures, too much problems going on there. If you have to do the CPR, you might do it worse. So I think these are the absolute contraindications. Other than that, I think that will be above my scope. So thank you.
Thank you, Miss. Any more questions? You guys. Yeah.
Good evening, everyone. And I would like to say a very big thank you to all our speakers. You really did marvelously well. For you.
Thank you.
In my attempt to save a life during an accident scene, and unfortunately, I ended up causing harm. In that instances, are there laws that protect me that I was trying to save life but I ended up causing harm? That's the first question. And the second question is, when I get into an accident scene, how do I know who actually need urgent care?
Okay, I think I'll take the first one.
Okay.
So with the law, that's why I talked about the Good Samaritan law. And this law is, although it's not explicitly in Ghana, but you can go to other countries. Let's say, for instance, we're in Canada or Australia and you administered the help and the person died. Because you offered a reasonable help to the victim at that moment, there's a lot that will protect you from being jailed or being sued for murder, because you're actually helping a patient to come back to life. But when it comes to Ghana, we don't have a specific Good Samaritan law. The principle of acting responsibly is the key in here. So this means doing what you have been trained to do and not attempting things you are not qualified for. So in such instances, the issue will be assessed. People will come into play to assess what happened during your administering. So you'll be talked to. So from your conversation and it's being found out that, oh, you actually knew what you were doing, but due to one or two things, this happened, then you are good to go. But if you had no knowledge about what you're doing and you just decide to help, then that's a whole new legal case. Please, was ahead.
Yes,
Yes,
please.
yes.
Okay. Thank you very
All right.
much.
Okay, so
Welcome.
with the
Thank you.
second question, I think that is my part. How to know if this one needs immediate care, like this person is. This is all
Yes.
about the priority, right? So I mentioned that in all accidents, you have to do, okay, I didn't mention the ABCD, but you have to assess the airway, the breathing, and then the consciousness of the patient. So with all the patients, you have to ask if this one responsive, is this person breathing well? If yes, then they're out of the way. You go to the ones, unless maybe those ones they are bleeding profusely, that they are bleeding, you need to stop that bleeding. So in that case, it's an emergency. You need to attend to that person, the one who is bleeding profusely. And then you also, then when you check the airway, the breathing, the consciousness, and then all these three are impaired, that means the person is arresting. There's a cardiac arrest. You need to do CPR immediately. Do not waste time, because once you waste time, that means the person's organs are not going to get blood, and then the organs might end up dying. The most important one being the brain. So you need to assess, you need in all situations, A, B, C, D, E. A for airway, B for the breathing, C for circulation, and then D for disability. So you check if there is a fracture or not. So you try to stabilize all these. So the most important ones are the ones that are unconscious, they are not breathing, and then their circulations are impaired. That is their pulse. You cannot access their pulse. And then also those that are bleeding profusely, you need to attend to them as soon as possible, like emergency. Thank you. I hope I answered your question.
Yes,
Yeah,
please.
so
Answer the question. Any more question
yes, I would want to
or any
add up
more
to
addition?
yes,
Okay.
I would want to add up. So to what Aisha just made mention of. So despite the use of the ABCD, there are also some color codes that sometimes is used in first aid. So mostly in spite of or at that moment where there's accident, we wouldn't use that color tag. But it's something you have at the back of your mind, which also helps in segregating the patient to know which one to help. So there are about 4 or 5. So I'll take them one after the other. So there's the red color code. That's the first priority, or those that need immediate attention. So with these people, it's critical. They're in critical conditions. Their conditions are life-threatening and needs urgent attention. So these people are those who may be bleeding severely, they'll be having chest or abdominal trauma. These people have head injuries or airway obstruction, that means they can't breathe. So these people should be given immediate attention, just like the ABC procedure. Then we go to the next color, which is yellow. So these are those that we call the delayed or the observation. So these people, mostly they are injured, but they are somehow stable. So with these people, they can wait for treatment after the rare cases are managed. So some of these people are those who have large wounds, but they are not necessarily bleeding. They have spinal injury, but they are stable. And sometimes they have some stable fractures that they can be held on for some time. Then the next color coding is the green. So these people, we sometimes call them the walking wounded. So although they are wounded, at least they can move around or they can help themselves with movement. They are those with these minor injuries, and if given aid, you can send them to another side. So these are people with bruises and sprains and some small cuts. Then the next one is the black. So these black people are those that are diseased, those who are dead on the spot, or those that there's no care for survival. With these people, no resuscitation is needed. Nothing can be done to them. They are dead and they are gone. So that's the other thing. And the last one is the white. So these are people that at the accident scene, they might have minor or no injury. They are very fine. They are very stable. They have no scratches and anything. And these people can easily be evacuated from the area. And later on, they can be sent to the hospital or nearest facility for care. So I think that's also one way of checking for the mass casualties or how to help people in accidents.
All right. Thank you so much. Aid
Welcome.
community of a school that takes individuals through first aid. With this meeting alone, I think I've learned one or two when it comes to accidents that occurs in a community. So from today, I'll be an advocate for change. Please, you can unmute your mic and say from today, I'll be an advocate of change. From today, you'll be an
From
advocate
From
for
today,
change.
today, I'll be
you'll
an
be
I'll
an
be an
advocate for
advocate
advocate for
change.
for
change.
change.
From today, I'll not be a content creator at accident
From
scenes.
I will not be a content
I will
creator.
not be a content creator from today.
creator from accident
Yes, I'll
scene,
be a good helper, not a content creator.
I'll
I'll
be a
be a
good
good
helper,
helper, not a content creator.
content creator.
Exactly. So from today, if you see anyone creating content at accident scene, what should we do to such a person? We educate the person about it. Okay, so any more question, any more addition? The floor is yours, audience. Any more addition, any more question? Please, if you don't have question, if you don't have addition, me, I'll call you. That one, trust me for that. Oh, I can see beautiful people over here. If I start calling names right now, people will hate me. Nafiu Mohammed, Sarah Nikwe.
Hello.
Hello,
Um,
Mohammed.
yes, please. I would like to thank the speakers for the great information they've given us this evening. I asked a question earlier and was answered by. It was answered, so I'm okay now. Thank you.
Dr. Benedicta.
All right, yes, please, Elizabeth, thank you so much, and thank you all of you for joining us today. We are so pleased to have you. It's a pleasure that you decided to join us this afternoon for this particular session, and I want to thank the speakers for such an insightful discussion. Elizabeth, thank you. Aisha, thank you. Franklin, well done. And I think Justice is off, but my regards to him as well. When I put this particular topic on, for those of you who are not aware, okay, I am Dr. Benedicta. I'm part of KNUST class of 2023. During our school days, we lost three members. Three members of our colleague, our class died. One from road traffic accident. He had an accident on the KNUST campus, and then he passed. The second one was she died from cancer. And then the third one died from a neurological disease. So this particular discussion that we are having, this particular topic, is a little bit emotional. It makes me think about, what happened back then. But I am glad that we are learning, at least we are learning something from it. That was one of the reasons why we had this particular foundation, our then class rep. We had this vision that let us have this foundation so that if we weren't able to do much for our classmates, at least our community can benefit. And so when you see RTC, Rita Tia Chichi Foundation, this is one of the reasons. You can check our YouTube page to get to know our story more. So I thank the speakers as well. When I put this particular topic there in my mind, I was like, this is a very difficult topic, but I'm glad that they've shared with us a lot of insights. It seems a number of us are healthcare professionals. We are either students, we are either, med lab, pharmacists, whatever students or health professionals. So if you're a health professional here, my encouragement to you or my admonishment to you is that you continue to learn more. A lot of CPR, a lot of basic life support courses are available. So even as you are learning in school, don't just learn it, for learning's sake, because many times these are quite real, especially when you start working in the hospital setting. You may one day, have such encounters either within the hospital or even as you are walking, by, because accidents are now becoming too common. They are becoming, rampant every day because of what we witness, mostly the pragia. When I started my house job, I used to get scared of, pragia people because many times there'll be accidents on our surgical unit. Every particular day you have a case of road traffic accident. It was mainly because of the pragia or the keke people. And so it's something which is quite common. So if you are here, you're a health professional, what I would tell you is that you have to learn your trauma, your ATLS protocols quite well so that you can save one other person. If you are here, you are not a medic, meaning that you are not a healthcare professional. There are a lot of things that were mentioned like CPR or cardiopulmonary resuscitation. You may not know what exactly it is. That's fine. When you see, when you are walking by, when you encounter an accident, this is what I want you to take note of. The first thing that you have to do is in resource settings, in other developed countries, there are emergency networks, ambulance is quite faster. I don't want to say effective, I would say faster. Here, our emergency systems, our emergency, services, they work. But sometimes you as a doctor, you call an emergency line and they may not pick up. So sometimes they are overburdened, sometimes the line doesn't go through, and that's okay. So that's why I really liked what Franklin says, that you as a bystander, you are very important, because sometimes he will tell you that call ambulance, call police, but in all sincerity, you may call them and then you may not have them, or you may not reach them, or whatever. So many times the bystanders who bring the accident victims to the hospital. And so if you are one of such persons, there are a few things that I want you to take note so that you don't end up injuring yourself because you are very enthusiastic to help, or you do not end up making more, you do not contribute more, to the injuries of that particular person that is in question. So when you go to an accident scene, the first thing that you have to do is to check the environment. Check the environment very well so that as you are moving towards the accident victims, there is no threat to you, because you as a person, you are going to help, but there's a fire leakage somewhere, or there's, a broken glass somewhere, and then you end up going to hurt yourself. So the first thing that you do is to make sure that you check the environment. You make sure that the environment is safe. So when you check the environment and you realize that this particular environment is safe, there's no leakage anywhere, there's no broken glass anywhere, then you can turn your attention to the particular patient, right? So when you turn your attention to the particular patient, you check the surrounding of the patient as well. Is there anything that is harming the patient? Is there any immediate threat to the patient? Because if there's an immediate threat to the patient, you would want to get the patient out very fast. So you check the environment. Is there a leakage anywhere that you need to take the patient out very quickly? Because the first rule most of the time is that you do not try to move the patient, but in a situation where there's an immediate threat to the patient, that let's say there's fire, if you don't take care, the fire could burn, there could be an explosion. For that one, the patient, there's an immediate threat to the patient, so the patient has to be moved out of danger very quickly. So that is a situation where you can move the patient. I think it was one of Aisha's points, the very first one, that you have to move the patient out quickly. So in that particular case where there's an immediate threat, if you don't take care, there will be an explosion. If you don't take care, something could happen. So that one, you can be, you can as well do your best to take the patient out of that particular scene very fast before the fire becomes more severe or before there's an explosion or something. So that one, you have to take note of it, right? So if there is no immediate threat to the particular patient, you calm the patient down. You want to know whether the patient is alive. And in what we call the trauma protocol, ATLS, is one of the protocols that we use. We do ABC. So I think Aisha mentioned them. So if you are here, you are not a medic and you don't understand, what we mean is there's a particular pattern that we use to check for sometimes the severity. As Aisha said, sometimes there are certain injuries that the patient will have, and then within minutes, the patient could die. Let's say if there's a head injury, there's part of the brain that is, the skull is broken, or there's a part of the brain that there's an injury. You know that this one, within minutes, the patient could die. Or there's a big vessel in the heart. There's something wrong with the heart, or there's something wrong to the blood vessels that lead to the heart. With those ones, they're very severe injuries. So within minutes, the patient could die. But you may not know. I mean, sometimes it's not very obvious to you. So the best way you can do is to do the ABC. So the ABC, the first one, you want to check whether there's, when we say airway, we are just trying to say the pathway that leads to the lungs, from the mouth to the lungs. Is it open? Because that's where you breathe. So we want to know whether it is broken, it is open, or it is not blocked. So one of the things that you can get to know whether the airway is patent is by the patient talking. So sometimes, so when you get to the patient, you try to call the patient. Sorry, the very first thing that you do, sorry, I missed it, that I mentioned that when you get to the accident scene, you have to make sure that you yourself you are safe. The very first thing you do is actually to call for help. So that's where you call for the emergency or the police. And as I said, in our country, you may delay or there may be a delay because sometimes our services do not work. So if our services do not work, then you go on, you check the patients around and whether there's an immediate threat. If there's not an immediate threat, then you come to what I said about the ABC. So you check, you ask the patients, you try to ask the patients whether the patients can hear you or let's say the patient's name. Who are you? You know, you are just trying to see whether the patient can talk, whether the airway is patent, right? So if you get to know that, okay, the patient can talk, it's likely that there's nothing troubling the airway, or it makes you also know that the patient is quite conscious. The second part is that when you get to know, you also have to assure the patient, make the patient calm. Because I mean, when it's a very life-threatening, it's a very scary situation. So when you get to know that the patient can listen to you, the patient is responsive, you make sure that you calm the patient down, that okay, there's help coming. So calm down. There's a way that we can help, like try as much as possible, all the sweet words, all the nice things that you can say to calm the patient. You say it or you tell the patient so that the patient can calm down. If the patient is unable to respond or speak to you, meaning that there's likely a problem with the airway, you use your hand on the nostril to see whether the patient is breathing, or you can also check with your head. When someone is breathing, you can hear it small, small. So you use your ears to check whether the patient is breathing. And then in C, we call it circulation. So circulation is like your blood. So you check the place, you check whether the patient is bleeding at a particular part of the body. So if there's massive bleeding anywhere and you have, let's say, a clean cloth, you can use it to compress. Depending on where the particular bleeding is, you can use it to compress the bleeding to make sure that, okay, the bleeding is you are trying to secure the bleeding. One thing that we are particular about regarding accident patients is the movement. And the movement, because if you don't move the patient well, you can make the patient paralyzed, especially with the neck. So I'm not too sure if some of you have seen, we call it the collar, the cervical collar. It's a very big something that we put on people's neck. I'm sure you've seen it in the movies. They put it around the neck of patients so that the neck can be stable. It is not for fun. I wish I had a picture. I didn't see it any of the presentations that were given. I wish I had a picture, but you can just search online. It's called the cervical collar. So it is to stabilize the neck. The reason why you don't have to move patients anyhow, because if there's an injury around the neck area and you are not careful, there could be an injury to the spine, and then it could render the patient paralyzed, such that the patient will not be able to move the hand or the leg. So that is one of the medical legal reasons, the one that Franklin mentioned, that in some countries people have been sued. So that's why you don't move accident patients anyhow. You move them carefully, right? You move them carefully. Even with the carefully, you have to make sure there's no C-spine injury or there's no injury to the neck, and you wouldn't know. So the best way or the best solution for you to protect yourself is to make sure the patient is calm, stable. Where the patient is, you make sure that the patient is where he or she is as you are waiting for the clinicians. The only time you would move the patient, as I said earlier, is when there's an immediate threat, there's fire and all of that. So that's why we are so particular with don't move patients, because if you don't move the patients, well, the patients will survive all right, but the patients could be paralyzed. And I mean, most people in that particular state would wish they were dead, even though, I mean, life is important. So you have to make sure that you don't move the patients anyhow. That's one of the things that I wanted us to take note during the discussion. But as I said, here in our local setting, you may not have the ambulance coming in the best way possible. Sometimes I'm not too sure, but those who bring our clients to the hospital, they don't really take note of the neck or the neck and then the C-spine. But then if you are as you are getting this particular knowledge, make sure that you are careful. And if there's any health professional that you can call to give you an advice, sometimes based on the state of the particular patient, especially if there's no neck injury, it may be the patient may benefit from just you helping the patient into the taxi and then the patient coming to the hospital. But make sure that if you have a health professional or anyone around that you can call to get an advice from, it will be good so that the person can give you guidance before you cause more harm than good. The last thing I would like to say regarding this one is the emergency contact. So if you are here, you should at least know the emergency contacts that we have in our country, Ghana, because we are in Ghana. So in Ghana, our ambulance service is 112. So you might want to write it somewhere so that if there's any, we are not praying, as one of our colleagues says, that we are not praying that you encounter an accident or you see one or there is an accident, but then the reality is that it happens. So when it happens, this is what you can do. You can call the ambulance service 112. I think the police is 119 or 192, but I'm not too sure. So I think I had it here. If I'm unable to see it right now, I'll send it on the page so that if you encounter something like that, you call the police. So this is what I wanted us to know. I'm sure that we have had a lot of discussions here, and I've also added my voice that when you see an accident, let me come back to it again. When you encounter an accident scene, the first thing is that you call for help. Calling for help, you call the ambulance. If you're not getting them, you try and try and try. If you know any healthcare professional that you know, your mother is a nurse, your sister is a doctor, you can call them so that they can also try to reach an ambulance. Sometimes those in the health professions, those in the health facilities, they're able to reach the ambulance services earlier than some of our people who are not in the healthcare professional. So make sure that you call someone, you call the ambulance. If the ambulance, you're not getting them, you call the police. The police too can also reach the ambulance. And then the second one, you make sure where you are going yourself, you are protected. You cannot try to save someone when you, as a person, you're in danger. You protect yourself. The second one, you check whether the patient has an immediate life threat. So let's say there's a fire that you think the patient has to leave at the very instant. And even with this particular situation where you want to move the patient, if you want to move the patient, make sure that the neck is stable. As I said, the neck is stable. So make sure that the neck is not moved. The neck is very immobile. So many times people, they lie down, depending on where the particular patient is, but wherever you find it, so make sure that the patient doesn't move the neck too much. And then you check whether the patient is breathing well. You check whether, if the patient is not breathing, you try to see if you can help the patient. But if you are not trained in that way, as we are saying, do not do too much. So that's the limit you can go. If you realize that there's an ongoing bleeding, which is very severe, that like the blood is coming out, for the C, you can get something clean to put it on and compress it so that the blood doesn't come out. The last thing I would say is that if there's a fracture, let's say if there's a broken bone, the leg is broken, the hand is broken, there's a broken bone, that one too, we don't move it too much, because when you move it, the bone which is broken, the sharp end can go and cut, let's say, a vessel, and it can lead to more bleeding. So if there's a broken bone anywhere, that part too has to be very stable. So some people take wood and they put it on and they tie it so that it can be very rigid. If you are not trained in that way, or if you cannot do it, you make sure that the patient's leg, which is broken, is not moved, right? So I think I will end here. There's a lot to be said, but I think that if you are not a medic, or even if you're a medic and you meet a situation like that, you have a fair idea of what to do before the healthcare professionals come. And when the healthcare professionals come, you just tell them everything, what happened, what you saw, the time that it has taken for them to come there. Let's say the accident happened at 3 a.m. or 3 p.m. You let them know, and then you let the healthcare professionals take over. So thank you so much. I hope we have learned something and we'll be able to practice the little that we've learned. Thank you once again. Hello, Justice. It seems Justice has gone off, but before we go, is Justice here? Okay, Justice
I think he
has
is
gone.
off.
Hello, Franklin.
Yes, please.
Okay, so I think my submission was the very last one, but if anyone has any other question or any other submission, you can quickly give it before we end. I think within 5 minutes, we should end here.
Okay.
Anyone with this submission, a question before we end?
Okay, and Dr. Benedicta, I think when you were talking about the bleeding and the fractures, I think I remembered one thing I would want to add to it. That's to the wound or the fracture. So sometimes at the accident scene, we encounter victims who have items or particles or anything stuck in their body. So sometimes in the wound, you find that maybe there's a metal which has pierced them, a stick or something. I would also want to advise that if we should meet victims or patients like that, we shouldn't be in a hurry to try to remove those stuck items from them. In a case where they are stuck in between the vehicles or something, the ideal way is to reassure them and wait for the emergency contact, or they might take a long while. I think it's very necessary to wait for them so that they can either cut between them and send them to the nearest hospital for the appropriate things to be done. Because sometimes trying to remove the stuck items from these victims might cause immediate death, internal bleeding, or even bleeding out, which might cause further injuries or that. But apart from that, generally, I just want to say that we are all helpers and we are all first aiders. So we should try our best. In one way or the other, we might meet accidents, or even if we meet someone, we can also have discussions with our friends and share this knowledge with them. Thank you.
Thank you very much, Elizabeth. I think Elizabeth has also made a very, very good point. That is very true. If someone has a knife, a sharp blade, which is stuck, in the body, please don't remove it. Let them come to the hospital. There's a way that it can be removed where it can be safe, because sometimes when you just remove it abruptly, there can be bleeding, which you may not be able to control, or there can be other damage to some of the organs, which because of how you did it, it caused more damage than it was supposed to. So thank you so much for adding your voice to it, Elizabeth. It has been a very good discussion. I'm sure we have learned a lot. If you've learned something or if you've benefited from it, I want to see some reactions before I say the closing prayer. Any reactions that help us to know that, okay, you've learned something. Okay, you've learned something. Okay, you've learned something. That's good. That's good. That's good. That's good. That's good. I've seen some of them. Thank you so much. Thank you so much. We've had a good time here, and I'm thankful that you have learned something. All right. So, if there are no questions, if there are no contributions, I would like us to take the closing prayer before we leave. All right. So, Father, in the name of Jesus, we thank you so much for a good discussion. We pray, oh God, that you help us to save lives. You help us to be helpers. You help us to be saviors. We do not pray for accidents, but we pray that in such cases, may we be found helpers. We thank you so much. We bless you for the knowledge that we've shared. We pray, oh God, that you bless our speakers, especially those who sat down to prepare presentations, to learn, to go through their books. Father, we know that they have put in so much effort. Therefore, we pray, oh God, that you reward them, you bless them, you honor their efforts and their sacrifices. We thank you so much in Jesus' name that we pray. Amen. I want to say one last thing. I just remembered something. You see, we said that you shouldn't be content creators as accident scenes, but thinking about it, I cannot ignore the fact that sometimes these content helps. Like you are calling an ambulance, they are not speaking, and then someone videos and puts it on live. And because live things go viral, it goes viral and then it alerts the authorities or the ambulance services gets to know that, oh, there's an accident happening here, or let's say the police service know. So if you want to engage in content creation for accidents, or let's say something is happening, you want to view it, it's not entirely wrong, but make sure that you have also done your best in what capacity you can do, whether you are helping the patient or you are stabilizing. Sometimes the best thing you can just do for the patient is to just calm the person down. Sometimes you cannot move the patient, you cannot do so much, but you can calm the patient down. So after doing all this, if you want to do a live, so that people can see it responsibly, as I said, with the aim that someone out there can alert the authorities early so that help can be received. So it's not entirely banned that don't create content or don't video it or don't put it live. Motive is very important. So if your motive is that, okay, so that someone will see it and then there can be help, I think that's a brilliant one and it's a good one in this age where everybody is, on the phones. So please, you can use content creation responsibly to help people in accidents. I hope we get this particular point. All right. So if there's none other to be said, I think this is where we'll end and then we'll say a goodbye to everyone. It's been a pleasure having you all. Thank you all so much for joining us. And this is a bye-bye from RTC Foundation. We'll have another one next week. Please be on the lookout.
Bye.
You can unmute and say bye-bye.
Bye
Bye
bye.
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 Bye bye.
Bye bye.
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 Bye. Bye. Bye.
Bro, be
Bye.
a